Margaret Chen sat in her doctor's waiting room, clutching a stack of referral papers. At 73, she'd always been diligent about her health, perhaps too diligent. Today's visit would change everything. Mrs. Chen, Dr. Patel began gently, I noticed you've scheduled yourself for a colonoscopy, a full-body CT scan, and extensive cancer screenings. Can we talk about whether all of these are truly necessary? Margaret frowned. But aren't more tests always better? I want to catch anything early. Dr. Patel leaned forward. That's what most people think. But after 70, some screenings can actually cause more harm than the conditions they're meant to detect. Let me tell you about 5 checkups that might not be helping you and could even be hurting you. First, let's talk about routine colonoscopies, Dr. Patel said, opening Margaret's file. You had your last one at 68. It was completely clear. So I'm due for another, right? Margaret asked. Actually, no. Here's why. Colonoscopies carry real risks: perforation of the bowel, bleeding, complications from sedation, and even infections. For someone over 70 with a clean screening history, the chances of finding cancer that would actually affect your lifespan are incredibly small. Dr. Patel explained that colon cancer grows slowly. If Margaret were to develop it now, it might take 10 to 15 years to become life-threatening. At her age, with no symptoms and clean prior screenings, other health conditions were far more likely to affect her quality of life first. But my neighbor had one at 75 and they found polyps, Margaret protested. And that's the other problem, Dr. Patel continued. We often find benign polyps that would never have caused harm. Removing them adds risk without real benefit. Studies show that for people over 75 with negative prior screenings, continuing colonoscopies doesn't reduce mortality, but it does increase the risk of complications. Margaret's friend Robert had experienced this firsthand. His routine colonoscopy at 76 led to a bowel perforation, resulting in emergency surgery, 2 weeks in the hospital, and months of recovery. All for polyps that likely would never have threatened his life. What about mammograms? Margaret asked. I've been getting them annually since I was 40. Dr. Patel nodded. Breast cancer screening is another area where the calculus changes significantly after 70. The risks start outweighing the benefits in many cases. She explained that mammograms can detect slow-growing cancers that would never become symptomatic during a woman's remaining lifetime, what doctors call overdiagnosis. This leads to unnecessary biopsies, surgeries, radiation, and chemotherapy, all with their own complications and side effects. The anxiety alone is significant, Dr. Patel added. False positives are common, especially as breast tissue changes with age. Studies show that for every life saved by screening in women over 75, many more experience harm from overtreatment. Margaret thought of her sister Elizabeth, who at 78 had undergone a lumpectomy and radiation for a tiny tumor discovered on a routine mammogram. The treatment had been exhausting, and her oncologist later admitted the cancer was so slow-growing that it likely would never have affected her life expectancy. Elizabeth spent her final healthy years recovering from treatment she may never have needed. So when should I stop? Margaret asked. It depends on your overall health, life expectancy, and personal preferences. If you have serious health conditions that are likely to limit your lifespan to less than 10 years, continuing mammograms probably isn't beneficial. The key is informed decision-making, not automatic screening. Dr. Patel continued, while this doesn't apply to you, Margaret, it's worth knowing about PSA testing for prostate cancer. Many women have husbands or partners facing this decision. She described how PSA tests for prostate cancer become particularly problematic after age 70. The test frequently detects slow-growing cancers that would never cause symptoms. The subsequent biopsies can cause infections, bleeding, and pain. Treatment, whether surgery or radiation, often results in incontinence and sexual dysfunction. Most prostate cancers in older men are so slow-growing that men die with them, not from them, Dr. Patel explained. Major medical organizations now recommend against PSA screening for men over 70, especially those with a life expectancy under 10 years. She told Margaret about Harold, a 74-year-old patient whose elevated PSA led to a biopsy that caused a severe infection. He spent a week in intensive care fighting sepsis. The biopsy showed low-grade cancer that his urologist said would likely never have required treatment. Harold survived the infection but wished he'd never had the test. Here's one that surprises people, Dr. Patel said. Aggressive diabetes screening and tight blood sugar control in very elderly patients can actually be dangerous. Margaret looked confused. But isn't diabetes dangerous? It is, over time. But extremely tight control aiming for the same blood sugar levels we target in younger people increases the risk of hypoglycemia, or dangerously low blood sugar. In older adults, this can cause falls, confusion, hospitalization, and even death. Dr. Patel explained that complications from diabetes, like kidney disease and nerve damage, take years to develop. For someone in their 80s or 90s, the immediate risks of aggressive treatment often outweigh the long-term benefits. We had a patient, Thomas, who was 86 with mild diabetes. His previous doctor had him on multiple medications to keep his blood sugar very low. He kept having dizzy spells and falling. When we relaxed his targets, the falls stopped, and he actually felt better. The slightly higher blood sugar wasn't going to cause problems in his remaining lifetime, but the falls certainly could have. The last one is something I see increasingly. Full-body CT scans or comprehensive imaging studies marketed as executive health checks or preventive screenings, Dr. Patel said. Those sound thorough, though, Margaret commented. They sound good, but they're often more harmful than helpful, especially after 70. These scans expose you to significant radiation. One full-body CT scan equals hundreds of chest X-rays. That radiation itself increases cancer risk. Worse still, Dr. Patel explained, these scans almost always find something: nodules, spots, or abnormalities that are usually benign but require follow-up. This leads to a cascade of additional tests, biopsies, and anxiety. We call them incidentalumas, incidental findings that would never have caused problems but now need investigation. Before you know it, you're undergoing invasive procedures for things that were never going to hurt you. She shared the story of Patricia, a 72-year-old who underwent a full-body scan at a private clinic. They found a small spot on her lung. This led to repeated CT scans every 3 months, more radiation, than a biopsy that collapsed her lung, requiring hospitalization. The spot turned out to be a benign scar from an old infection. Patricia endured complications and months of worry for nothing. So what should I focus on instead? Margaret asked, feeling both relieved and overwhelmed. Dr. Patel smiled. Focus on what really matters at this stage of life: functional health, quality of life, and preventing falls and cognitive decline. Let's make sure your vision and hearing are good. Let's check your balance and bone density to prevent fractures. Let's review your medications to ensure you're not taking things that increase fall risk or cause confusion. She continued, stay physically active, maintain social connections, eat well, and manage your blood pressure and chronic conditions sensibly without overtreatment. If you develop symptoms, we'll investigate them. But chasing numbers and screening for diseases that may never affect your quality of life, that's often not the answer. Margaret thought about her friend Helen, 92 years old, sharp as ever, who went for daily walks, played bridge twice a week, and focused on enjoying her grandchildren rather than constant medical tests. The goal isn't to live forever, Dr. Patel said gently. It's to live well for as long as you're here. Sometimes less medical intervention means more life, more energy, less anxiety, fewer complications, and more time doing what you love. Margaret left the office that day with only 2 appointments scheduled: a vision test and a bone density scan. She canceled the colonoscopy, decided to skip her next mammogram after discussing it with Dr. Patel, and felt, for the first time in years, that she was focusing on staying healthy rather than searching for disease. The end. This story illustrates important principles about medical screening in older adults, but individual circumstances vary. Always discuss screening decisions with your personal physician, considering your specific health status, family history, and personal values.